Margie here. Unfortunately, too often people are telling me they're having problems talking to their physicians or healthcare practitioners about osteoporosis. So that's what we're going to delve into today because this is really important. And I invited to join me my husband, Dr. Craig Bissinger, who's an OBGYN, and he deals with this on a daily basis. So he has really good insights to share and tips that we can all use to improve this. So in this talk, what you're going to learn is number one, why is there a problem? Why are people having issues? Number two, how you can best be prepared for that doctor or practitioner visit. And number three, what are the tests that we absolutely want our doctors to do? So lots of great information. So stay tuned. Welcome back to the podcast, Craig.
Thanks. I'm looking forward to a nice conversation with you and sharing our thoughts with your audience.
You know, this topic that we're going to talk about today is so important because I hear all the time how people are so frustrated with their doctor visits. And I think there's a lot of things that we can talk about to really help people make this really optimize the time they spend with the doctor and get the most out of it. So let's just get started with this. You know what? I think the first thing I want you to do is why don't you share? Because you deal with this every day, so you know exactly what I'm talking about. Why don't you talk about some of the issues that physicians have? Like, what is the problem here that people don't seem to be getting what they need from their doctor's visit?
Well, I'm going to give you a couple of thoughts on that, and then we can go back and elaborate a little bit further. So I wanted to say, first of all, that I appreciate the opportunity to talk in front of your audience. I look at this from a doctor perspective, and I also as a patient sometimes. So I kind of have a basic, as everyone else does. I'm going to doctors like you all. Obviously, I have some different sets of knowledge than you do, but that doesn't mean I don't have sometimes not as much knowledge about the topic as they do. So I think it's really important for us to understand what the interaction is between patient and doctor in these experiences. So I really do appreciate that. So the first thing, as I'm going to say, is it's time, and it's time. Simple as that. And we'll talk about that a lot. I think the second thing that comes into this situation in the conversation is the patients sometimes are not prepared or don't have enough information when they come into that conversation, which I think causes a problem. I think that also causes hesitancy from a patient to really engage the physician and express how they feel and ask those kind of questions that they really need to do, because the dynamic of that relationship has always been skewed towards the physician. And I find that to be a challenge for my patients a lot, hopefully not as much as maybe others, because I do try to engage, but I think that's a big issue. I think that osteoporosis itself doesn't blend itself to a short conversation. It just has too many parts to it. It is complicated. As I've been listening to your podcast, over 330 of them by now, it's complicated. And I listen sometimes and I do scratch my head. Other times I'm right there with you. And believe me, my patients benefit all the time from all of those times I've listened to you practice all the work you do, and I appreciate that. But nevertheless, it is a complicated condition. We're going to do a little bit of conversing about that as well. And the last thing, which I think most doctors are very guilty of, is just trying to hand out a pill or a medication and leave it at that without really making you understand all the issues that we were just talking about. But the medicine is just not an answer a lot of the times, and you have to dig a lot deeper, which I know we've pounded on that conversation forever, digging deep. And that is something that I see all the time in that relationship. So those are the top 5 things.
So let's start with time. And why don't you talk about a typical physician's schedule? And when someone comes in with osteoporosis and maybe they just want to tag it on to the end of a yearly exam, or why don't you just explain that? Because this can be very frustrating. And I think there are ways around this so it doesn't have to be that way.
Yep, that is a chronic condition, and it's different across the country by practice, by provider. And so maybe I can kind of share several different ways that you look at it. The first thing is a schedule is created by the office. Typically, for us, each provider knows how much time they want to allocate for a general annual exam, also for problem visits and for new patients. So we try to allocate between 20 and 30 minutes for those specific type of appointments. That's not to say everywhere does. I have friends who are in practices that are part of big health conglomerates, and they have between 12 and 15 minutes for a visit, for like even an annual visit. And when they don't finish that time on time, they get a knock on the door or somebody saying it's time to go. And so the doctors feel a lot of pressure in those circumstances as well. When you are scheduled for an annual visit with your physician, that doctor has allocated a specific amount of time just to review your past year, your history, your health. They're not prepared during that time to engage in a conversation about any other problem. And it's not that they don't want to, it's just that if you continually do that, you're never going to finish your schedule on time, which isn't necessarily that important. But it just is very dysfunctional for them and frustrating for all the patients as well, because they have some expectations, maybe that you'll be available to just discuss. I have patients who want to talk about 3 or 4 things during that visit that I can't accomplish all those at that time. So that creates frustration and maybe higher expectations sometimes from a patient than they can receive during that time. So to me, the best thing to do is you may want to, in those circumstances, ask the secretaries or the front desk staff to create a separate appointment to discuss specific problems so that you can do your annual visits uh, on a routine basis and then allocate time for more specialty concerns and considerations other times. So, and again, it depends. There are some practices, and there depends if what kind of providers you're talking about, not necessarily doctors. You can have nurse practitioners, you can have physician's assistants, DOs, all kinds of other people who may change and do different kind of scheduling. But when you work with bigger corporate entities, the physicians have very little control over the time they're allowed to allocate for patient care. And I think that that is a big problem. That's why I said it's time, it's time, it's time.
Hey, Margie here. High quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store, and in there, you'll see my favorite bone building supplements. So make sure to check it out, and the link will also be in the show notes. So let's get back to the show.
Yeah, I think that's really important. So if people know they can't expect from a 15-minute visit to really delve into osteoporosis. So I think that's a really good point that I have an issue I need to talk to. It's more of a problem appointment or a consultation when they make the appointment with the office. And the second thing is, as I've talked about so much, there really is a difference between how conventional medicine approaches this. And also then if you really do want more time, that's where a functional medicine or a more integrative doctor who looks at things differently and spends more time on all the root causes, etc. Now, it may not be covered by the insurance, so there's a give and take. But I think people should know this going in, that that's how a doctor's office works. And I think the medical model is like you said, a pill for an ill. Okay, what can we do? You get the minus 2.5, you know, they may tell you, okay, calcium, vitamin D, and let's go on this medication. So oftentimes it is very quick and it's not really as thorough as we would like. So I think that's really important to know. So let's see, the next thing you talked about.
It's lack of knowledge.
Yes, yes, yes. This is such a big thing that I see. And people are, I think the doctor model used to be so different where, you felt that you didn't know anything and the doctor knew everything. And then the doctor would impart the knowledge to you and he would tell you or she would tell you what to do. But that's changed so much now. And I see when people are empowered, when you are empowered with the knowledge, you go in so differently and you're an active participant in your care. And that's the only way to be. And if the doctor is not willing to work with you in that respect, right? Time for a new doctor, because that's the only way that I think that it works and that you can work together so that you get the best outcome and that, things that's just the best way moving forward. You want to share? I know that you've used that and really helped educate people so that they could be knowledgeable and make the best decision for their care. And you have some really good stories. Are there any ones that you want to share?
Well, the first thing I want to say is, as a provider, even if you schedule time to come in for a consultation, it's very difficult, even in a 20-minute slot, even a 30-minute slot, to be able to impart enough knowledge to somebody who hasn't prepared a little bit and understand the basis of what is osteoporosis. Because I really don't think my job should be to start you from the beginning and walk you through all the things that go into making your bones thin. Not that it's not important, but it's something that I would hope that you may choose to look into a little bit and understand. So when we come together, you have more knowledge. That's my hope when you come and see us. Now, since I've been stopping my obstetrical practice, I have been seeing a lot of my patients. I delivered the babies 20, 30 years ago, and some of those patients now are reaching those 50s and 60s. And I've inherited a few 70s and 80s from my other partners. And so I'm seeing DEXA scans all the time, and I'm running over to Margie and saying, Margie, what do you think about this one? And what about that one? Because there's a lot of stuff that I keep trying to get straight in my head, which I understand, but there's a lot of nuance. And I don't think anyone in my profession has been trained adequately as an obstetrician, gynecologist, as an internist, as an endocrinologist, rheumatologist, any ologist, an internist, and all the things that are going on in that field. And so just as a starting point, when you don't have much of a base to start with, it's really hard for me. So what I've done with some of my patients is when I get their bone densities back, and Margie tells me this isn't how it is with most people, but someone in your office or our office should reach out and talk to the patient about the results of her test. And they should be informing them that they either have thin bone or osteoporosis, and that they should come in and schedule a consult visit with a physician. They should also be telling them that there are resources that maybe they'll be giving them as a referral so they can read about and have some basic knowledge so that when they come in for that visit, it's really productive. Because the physician wants to move that needle ahead so they can figure out what's the best way to help you get better or make your bones stronger. And the patient really comes in without a lot of knowledge sometimes, and it makes it really hard for them to understand and digest what's being told to them. So I can just tell you one of these stories, and it was kind of nice for me to hear this. So I had not a young lady, maybe a 58 or 60-year-old woman who I'd order a bone density test on her. And her first visit for that test, first DEXA scan, and her bones were about 35% thinner than they should be for any age, which means she had osteoporosis, and it's certainly at risk of spinal fracture. Of course, I gave her that information, and she was a little bit stunned because no one expects to hear that. And then we started talking, and I realized that I was not going to be the right person to handle her specifically because I just can't give her exercise and nutrition and stress reduction, all the things that Margie and I have talked about, and she's talked about with you. She's in need more. And we recognize that. So I basically told her about a program that Margie does. It's called the Roadmap. And basically I explained to her that it is a wonderful program. And I'm not going to go into all the facets of it, other than the fact that it's 4 different modules with some Q&As. And each class probably takes an hour or so. And it goes through the highlights of root causes, the blood testing, it goes through exercise, it goes through dietary issues and just lifestyle issues as well, so that when they come back and have a conversation with me or other providers, they're prepared for that conversation. And in fact, I did refer this patient off to a rheumatologist, and I got the lab test back about a week and a half later after she went, and I was so happy because all these blood tests that Margie has talked about, Keith McCormick, Kim Millman, and all kinds of people on the show, Diva Boone and others, have been talking about forever. This guy did it, and I'm like, oh my God, I found my man here. I got a soulmate. So I'm talking to the patient. I'm sorry to keep you guys. I talk a lot and tell stories, but I talked to my patient. I said, "Oh, you found the best guy. He did your blood test." And she says, "What do you mean?" I said, "Well, he did all the tests." She says, "Yeah, I wrote them all down. I went in, I asked him for all these tests." And I said, "And he did it?" She says, "Yeah, of course he did, because I asked him to." He put her on the right medicine, and she's doing well. But boy, I realize there's something powerful in that knowledge. And I don't think you should be, as we're going to talk about as my next little thing, we'll stop right at that moment. So why don't you ask me the next question, because I'll continue that
No, I
conversation.
wanna just talk about that for a minute. So, the test that she did, because here she had I think a minus 3.5, very low bone density. This was her first test. But we need to know more. We don't know. We don't know what's going on. We don't know, is her body actively breaking down bone? What's going on? So you did numerous tests, and one which I think is so important, and I just think everybody needs to do this, is the CTX, which is the C telepeptide of type 1 collagen, but it shows the breakdown, what's going on with your bone, the osteoclast, the bone, the cells that break down bone. It shows, the activity there. And we did the P1MP, which shows the bone building cells. So we really got a good idea that she was actively losing bone. Something was going on. Her bone density was very low, very high risk. And in those situations, which I think for everybody who knows me, it's not my first choice, but there is a place for medication so that you can build that bone up while you're doing all the other things. And so that's what happened with her. But because she did all the testing and she learned what everything was, and then she could work with the rheumatologist who can do, because if you do end up going on medication, you really do need to be with people who do this all the time and they know the medications and they know how to work them. But anyway, the point was she became educated, she got the right testing, and she was able to move forward, and she's doing everything else. You got her into exercise and nutrition, and so I think it's so important. And this is what I found from people in the community, the people who, when you become involved, and if you're listening to this podcast, you already want to learn as much as you can. But then you can be the partner with that doctor because you understand, and you can say, I've had so many people, because I recommend the CTX to everybody, and they just ask the doctor, I really want to understand, am I actively losing bone? Can we do the CTX and the P1MP? And I would say many times, the majority of times, the doctors agree to it. Sometimes they say, oh, I don't think those tests are accurate. And the reason is that it has to be done first thing in the morning. If you do it different times of the day, you can't compare it to each other. So it has to be done first thing in the morning because it changes. And there's no supplemental biotin, no collagen, no excessive exercise for around 48 hours. So I think done the right way, it gives us so much information. And, it's not a one size fits all when it comes to osteoporosis. And that's what to me is so upsetting. A number on a DEXA does not go along with the medication. It's so much more complicated than that. And when we can figure out what's going on, treat it appropriately, treat the root causes, and do everything else, that's when people really get better and the whole life gets better. So I think, but that was I was really happy to hear that. At first, when you told me this doctor did all these tests, I'm like, oh, I am so glad we found a local doctor who can do, I just thought he ordered them. I didn't realize that you had given her, that she took the roadmap and learned all about this herself to ask the test. So I think that just shows an empowered patient what can be done. And I see this all the time. And unfortunately, that's what has to happen. But it's okay because I think because I think the doctors don't know everything, and we can't go in with that attitude that they know everything and we know nothing. So, okay. So yeah, that was a really good story. And I do have the roadmap available for people. And I just want to share what that is, because after the summit, and I've had 4 summits, and after each summit, there's so much information and people get overwhelmed a bit. And, overwhelm is not our friend, because so much information sometimes is too much. So I created the roadmap to just get people on the path, on a roadmap. And so the first class is all about testing, and really, what are the important tests to do? What are the root causes? What testing could help us? The second class is all about nutrition. I think now I'm thinking of which order it's in. Well, I think it's on nutrition and supplements, what we need to do with food and nutrients. And the third class is on exercise, or it might be the opposite way around. On exactly what we need to do with exercise and what are the most appropriate exercises, and really the knowledge of why you're doing it, not just do this exercise. Why? You need to know, not just Margie said to do this, but, oh, yes, I understand this does, this is helping increase bone density, or this is increasing fractures, or so that you understand the whys. And the fourth one was stress and happiness, because so many people don't realize that stress breaks down their bones. And, I think a lot of us people live a very stressed life, and it doesn't have to be that way, but it actually really it really puts negative forces on your bones. So anyway, that's what the roadmap is. And for anybody interested, I try to keep things really inexpensive. And so normally it's $197, but if you just use a coupon code SAVE 150, it's only $47. So I'll put that in the show notes. But anyway, so we've talked about lack of knowledge. So the more you can learn, there's also a great book. I have it here, Great Bones. Dr. Keith McCormick. Now, he's been on the podcast numerous times, and he has a talk on the podcast on medications. That's the pros and cons. That is so good, really talking about how you can use medications in an integrative approach. And so often people, under no circumstances would they ever use a medication, and then they have a fracture. So there is a place for medications, and he does a really good job. So I highly recommend that podcast. But his book is like an encyclopedia. It's not to bring to the beach, but it's just full of so much good information and test results. What are you looking for? So highly recommend that. Anyway, that in terms of knowledge. And then also Dr. Kim Millman, who I've been working with a lot. She has some great podcast episodes. So lots of ways to get information. But I think the more knowledgeable you become, it's just a win-win situation.
Couple of things. Number one, involved with happiness is don't forget about depression, because people who are depressed have more osteoporosis for, I'm sure, a variety of reasons, from medications to just not getting up out of the chair to do the things they need to do to improve their strength. So that's number one. Number two, can you please show the book straight up, because I couldn't see how to read the name of the book if I wanted to. So put it up higher for everyone to see. I'm not trying to. I love this book. It's so doggone. How many pages in this book, Margie?
Okay, Great Bones. Like
How many books? How many pages in this sucker?
This book.
I'm not going to read it, by the way.
No, it's a reference book. It's like
how many pages, Margie?
No, but if you include the references, I think it's around 700 or so.
Okay, so please don't make everyone feel they have to read a 700-page book.
No.
But we are going to tell you a story in a few minutes about a patient who read 300 pages in the book, by the way. But we're going to hold off on that for another one of our little conversational pieces. And what I wanted to also talk about was the hesitancy to engage in conversations, which is what Margie was just really kind of referring to. Because when you're empowered, you take ownership of your problems, and you're able to have a much more constructive visit with your provider. And I understand the dynamics of the doctor-patient relationship, and unfortunately, a lot of my peers take advantage of that in controlling the conversation and what you hear in the time that's involved with that conversation. Some of it's out of necessity, and some of it's out of practicality. But I think that if you come in knowing things, that's why we wanted to talk about the roadmap. That's why we wanted to tell you at least the story of how it does work. I mean, obviously, you always need to be respectful of the doctor and their time, but you can also say things in a very kind and pleasant way, like, do you mind if I asked you a question? Or would you mind if my sister is in here to listen on the conversation so that I can absorb the information better? And then you also, the one thing I always think is really good, you can say, well, what would you do if it was you or your family? That changes the dynamic a little bit because it kind of makes the physician kind of think like, gee, they have family too, just like I do. What would I tell my wife or my sister? So I think that those are a few nice, kind words that you can do to try to keep the conversation going in a pleasant way without trying to also come in with a chat GBT, which is going to have 42 points for you to talk about. And you're going to hang it in front of their face and say, I want you to answer all these questions for me. I don't think that's a constructive way either. I think there needs to be a respectful relationship. But I always tell my resident doctors this one story. So I'm a obstetrician for many years, and I meet patients oftentimes who I cross cover other practices. And when I go there to meet the patients, I'm very strategic in my introduction. I come in the room, they've got a red garbage can and a beige garbage can. The beige garbage can is taller, the red one is short. I always sit on the lowest thing I can in the room and I start to talk to the patient. Now, why do I do that? Because too often doctors tower over you, looking down at you. And it's a dominant kind of concept of I'm talking to you. It's about I'm looking up at you and I'm talking to you, or we're talking more in a peer way. So I recognize the dynamic, and many doctors do. So please make sure you're comfortable in that relationship. Come in prepared. Don't try to bully anybody. Just listen and ask. And because Margie's going to tell you, some things about the comfort level and your comfort with a physician in a few minutes as well.
Yeah, I think it's so important that you do feel comfortable. And I'm a big vibes person. And if you don't feel this person can be your partner and work with you, then it's time to switch to another doctor. And, oftentimes the conventional doctor will not be the person that's really going to work with you on your gut issues and really dig deep into the root causes. But that doesn't mean you have to alienate them. That doesn't mean that you can always say, I'm also going to be working with a functional doctor to look into my gut issues or whatever. So you can keep everybody, you can keep everybody involved. But the other thing is you can also ask for referrals. If you don't feel comfortable with supplements or nutrition, and doctors, right, Craig, they just really do not have a background in nutrition. So it's not even worth asking them unless, am I right about that? For how much?
Calcium, magnesium, and D, and see you tomorrow. Or maybe see you next year,
Yeah, no,
unfortunately.
I'm saying how much did you learn in medical school? And even people coming out now, very little nutrition. Is that correct?
1 or 2 hours of medical school, probably.
Yeah. So the point is that you can always ask. First of all, they may just say, oh, exercise, make sure to do weight bearing and resistance exercise or something, but then ask, say, you know what, and some places you can just go to a physical therapist yourself, but sometimes you do need the referral. Just say, I'd really like someone to help me with that. Can you give me a referral for physical therapy? Or is there a dietitian, a nutritionist that you work with who could help me with certain things? You can always ask for referrals for people to help you on your path as well. So I think that's really important. And, while you're keeping the doctor in the loop, and I think we can do that in a way that doesn't alienate the doctor. So I think that's really important because sometimes they forget to, I mean, I know you refer everybody to physical therapy, but not every physician does that. And that's such a big help when it comes to osteoporosis.
Well, I totally agree with you on this point because there's, as you had just mentioned about the roadmap, there are 4 parts, and in each of those parts, you have multiple providers who are going to know pieces of that puzzle, but they just don't know it all. I don't care if you got a world famous endocrinologist or the best physical therapist in the country. This is a team approach, and you need to have a good leader at the top of that ticket who knows who to send you to and how to kind of help you to guide you through those processes. Because when you start digging in on yourself on your own, maybe you get somebody who's okay, or maybe you get someone who's just doesn't know a lot, but figures they might as well, what the heck, give it a shot and see how you do. But this isn't that kind of case. Um, you have a lot of time on to do this and deliberate to make sure it's done properly. From the time of being told you have thin bone, nothing's going to happen. Nothing now. This is a slow march over decades. And anytime you start to identify what's going on and you try to change the trajectory of this condition, it's a good time to do it. You don't sit there and say, oh my God, it's too late. It's never too late. It's maybe a time to give you the opportunities, Margie said, to take a reprisal of who you are, where you are, and what's going on in your total life and make changes. I always kind of tell patients that osteoporosis, your gut, your gums, your mouth, your hair, your skin, they're all growing faster than most everything else in your body. And if you're not taking care of your body with one problem, it's going to affect all the problems. So when you hear autoimmunity and other conditions being talked about, they're all part of the same process. Take care of your body, exercise, eat well, get the right team with you to support you, and all of these things get better. Would you like to say anything about that,
Well, you know,
Margie?
my saying is osteoporosis. Well, two things. It's an opportunity. It's an opportunity. You get this diagnosis and you're feeling great. You don't feel bad. All of a sudden, you come back from a bone density and you get this diagnosis, and all of a sudden, this active, amazing person is completely freaked out. They see their life, you know, their active life of travel and grandchildren and all this. They see it. They see it like that. That's history now, which is just not the case at all. To me, it's okay, what's going on now and what can we do? And when we take steps, everything gets better. And what I've been seeing so much of, and maybe because I'm so involved myself, is the exercise piece. People are getting so strong, and there's nothing more empowering than being strong, but also reducing your stress and figuring out these underlying root causes, which I want to talk a little more about. You know, it's just everything gets better. Things you've had for years and years, all of a sudden, you know, all of a sudden things, you know, like you didn't even realize that that you could live without certain issues. And so I think it's a win-win. And people do go look back and say, you know what, this diagnosis was a blessing in disguise. And that's what I really see. I turn it around instead of saying, oh, poor me, look what happened. Just the opposite. Like, okay, what action steps can I take? And then when you do, I just think life becomes so much more miraculous. And I've been doing this so many years, so I can say that with working with lots of patients and, you know, just seeing this happen and having a large community of people who are also feeling that way. So, yeah. But I did want to say something about root cause testing. One of the biggest things that I see missing in conventional medicine, and this is just so upsetting to me, and this is something that you've dealt with personally, Craig, is root cause testing. It's just not done. You know, I know for the workup for osteoporosis, typically when people do see the endocrinologist, they'll do celiac testing. They will do a 24-hour urine. They will do to make sure they don't have multiple myeloma. So some of the root cause testing is done, but they're not doing, you know, where they do celiac, they won't do gluten sensitivity. They're not looking at blood sugar, and they have a different value on calcium, which we can talk about in a minute. But why do you think they're missing some of these root cause testing, gut issues? You know, if people aren't absorbing, it's just not looked at in conventional medicine. Why do you think that is?
The first one is time. And I'll say it like I did it before. There's not enough time to go through all that during your visits. And the second is the knowledge. The knowledge is kind of it's not sexy to dig this deep in all these things. And I just think that doctors just want to give you a pill to get you moving and know that it's going to make your bone density score nice, but it may not actually address the real problems that you're experiencing. So I know that there'll be a reckoning and a time where this will all change, but we're not there yet.
And that's why I really do. I'm such a big believer in integrative and functional medicine. And that's why there are ways. You can always go to the Institute for Functional Medicine and see who's in your area. And, if you do want to dig deeper and really want to look at root causes. And also, practitioners, I think I've told people on the podcast, but Dr. Millman and I just recently started a certification program for practitioners, really teaching about root causes, and so that there'll be people. That's our goal, to get more people in the world who really understand this and can help people with this integrative approach. So before you know it, there'll be more people out there. But the point is, you can't, you must look at the root causes. And we've talked about that a lot on the podcast. And I've talked about this before, but I have to say it again. You yourself have to look at your calcium, your blood calcium values, because why is it in medical school that they don't teach this number? It's so crazy to me. I know when the lab doesn't separate it for age. So they have like when you get your blood calcium, it may say that it's okay because it's a very wide range, but if it's over 10 and you're over 40, you need to look at this, because you could have hyperparathyroidism, and it's a parathyroid tumor that's really causing havoc on your bones and causing bone loss. And we've talked about this in the podcast, but it's something that I want everybody to look at, because what happened? Do you want to explain what you learned in med school about this?
I went to med school a long time ago. It's embarrassing at this point to remember, but they just gave you values, and we knew that some people have hypercalcemia, and we got some differential diagnosis of what was going on, and that was the end of it. But they didn't demarcate age-based calcium levels. So I can tell you that I've seen patients who, as you know, we've picked up parathyroid tumors on just from listening to Diva Boone's podcast on your summit. And I know that Diva has, I think from all your summits, had dealt with 70 or 80 patients, 20 each summit or so, who were diagnosed with parathyroid conditions simply because they listened and realized that things were not right, and they went back using that information to advocate for themselves.
It's so true. It was around 20 people per summit. And I've never had people so thankful in their lives. And they picked it up themselves because, and I'm not faulting the doctors. And Dr. Diva Boone said that. For some reason in medical school, they're like, oh, well, you just watch it, but you can't watch it. If you have this tumor, you're continuing to lose bone, and it's a cure, it's a treatment, it's a surgery, but it's benign. And it's amazing to me. And also, these are people who may have other symptoms too, like fatigue, and you've had what, 40-year-old, you've had younger people have this as well.
Yeah.
But the thing about it is that, they picked it up themselves because the doctor was like, oh, we'll wait on it, or they didn't really see it. And so I think this is just something that I always want everybody to look at their own blood calcium values and just see. And you can also go to her site, if you just Google Dr. Diva Boone, and she has a calculator there where you can put your blood work in, and it's so good. And I'm gonna have her come back on the podcast again, see if anything's happened recently. But she has a very good episode as well. But the point is, another illustration of knowledge is power. So blood calcium is so important. Blood sugar is very important because that's going to affect your bone health, and as well as gluten, any autoimmune thing. So I always love people having homocysteine tested, and high sensitivity C-reactive protein, CRP. Those are just some good tests to see overall inflammation, because when we do have inflammation, that can break down bone. And so we need to get to the root cause. So important. But anyway, we can talk with that. But I think the key here is about the doctor's visit. So is there anything else we want to also bring your medications in? I think that's important. Am I right? Having a good list of medications, because some of the medications will affect bone health and you may not even realize that. So I think that's good to always have when you come to see your doctor as well.
Right. I think it's time for us to give a quick little summary and for what we've been talking about. And the first thing I want to remind people is learn about osteoporosis. That's what we talked a lot about. So you go in knowledgeable and ready to have a good conversation with your provider. You should be your own best advocate as well. You could seek other opinions if you don't feel you're being heard or taken seriously. I can't stress that enough because sometimes they don't have an interest because they don't know much. I think that it's perfectly reasonable to go find somebody who specializes in bone health, and that may not necessarily be your physician or endocrinologist. It could be a member of the Bone Health Academy classes, or it could be a functional medicine physician or somebody who's done a lot of work in the field. But you need to find people who are on your side who can help you the way you want to be treated. And that's a big problem that we don't talk about. Sometimes the doctor doesn't want you to do what you want to do. And that's okay. You can tell them that you're uncomfortable with that and you'd rather seek other options, but you appreciate them and you'll keep them in the loop of what you're thinking of doing. And at that point, I think you should also try to find a community of people who are in the same issues health-wise and as far as osteoporosis as you. I think it's better to know that you're not alone. I think it's good to hear what other people are doing because there's a lot going on. There's a lot of people with different wonderful ideas. And some of them may resonate with you, and some of those may be the exact thing you need. So don't be afraid of having a community or reaching out.
No, I wanted to say one additional thing with what you just said in terms of the doctor. In also, let's say the doctor does say, "Okay, I recommend, this certain medication, and this is what I'm recommending." You can just say, "Thank you so much. I need a little time to absorb this." And you don't have to give an answer. You don't have to say yes. You don't have to, I would really like to just wait before we go to that step, or you can do whatever you want, that I'm going to just take a little time, or you can say, you know what, I really haven't exercised or done the nutrition, or I want to explore root causes. And so you don't have to make a decision right away. You can just pause it and say, let me think about this. So, don't feel pressured that you have to get the prescription that they're ready to write. You can just stop, think about it. Oh, one more thing we didn't talk about, one of my absolutely favorite people who has helped so many people in the community for consults is Dr. Keith McCormick, and he's been on the podcast before. But oftentimes, if people are debating, should they go on a medication, should they not, they can't figure out their root cause. I recommended people see him, and he's helped so many people. He's just really brilliant, and he's a person who knows how to use the medications and what medication would be right, if it even is necessary at all. So I'll put his information in the show notes as well. And Dr. Millman has a course that I teach part of also. The next one's not going to start for quite a while, but it's called Restore and Rebuild. So if you want to learn how to do all the tests and really take an active role in this, that's another possibility. And there's always my community where we have once a month, we meet for question and answers, and there's lots of information as well. So I always try to help people on their paths too. So many ways to get there, and just know it's all possible. And we just wanted to give you some tips so that you can feel empowered when you do go to the doctor and make the most of the appointment. So I so appreciate you, Craig, for joining me, because you deal with this every day and you're in the middle of this. So I really am glad you came and shared your insights with all of us. Any last minute things for everybody?
I want to thank you all for coming and listening. I know there's a lot of other things that can occupy your time and attention, but your health is probably the most important thing, and you have one life to live, and you want to make it the best life you can. And listening to Margie makes my life the best it can ever be. And I can tell you that she works very, very, very hard to make sure and curates her conversations, and she finds the best people. And as I say, she's like a dentist. She extracts from them things that they may not want to part with, but all the secrets that they are hiding so that they'll have you come back and listen to them another day. So you're not a dentist, but you certainly know how to extract good information, actionable information for your patients. And I'm just blessed to have you in my life. And I've met many of you now along the way. We were someplace and somebody goes, I know you. And Margie goes, huh? She says, you're Margie. And she's like, uh-oh. I don't think she appreciates how much she's appreciated, and I want to acknowledge that. So I appreciate you, and I know the people around here appreciate all your time and efforts and devotion to your cause.
Oh, well, you're very, very kind, and I appreciate you too. So, thank you, and thanks everybody for being here. I'll put all the information in the show notes. I hope you enjoyed my interview with Craig as much as I did. So now on your next visit to your physician or healthcare practitioner, you're going to go in empowered. You're going to go in confident and look at this person as a partner in your health. So you are an active participant. So I hope some of the things we talked about will help you. And it's just a win-win situation. So thanks so much for tuning in. I look forward to seeing you on the next episode.